This time we're going to tape for the medial collateral ligament of the knee. Just like we've done with the elbow, we're going to tape and try and get the inside of that knee joint. The anchors are going to be very similar to what we saw with the hyperextension for the knee. So starting on the calf. This time, because we're not applying tape to the posterior side of the knee, we don't need to use our heel and lace pad on the back side. Again, we have the heel propped up just on a roll of tape to get a little bit of bend in the knee. So I'm going to go ahead and do my anchors on the calf. Again, this is one that a lot of times we would do either with some extra adhesive spray or we would do it directly on the skin because it wants to slide. So there's a prime example of letting your tape go where it wants. So we're going to do 3 anchors. And then we're going to do 3 anchors on the thigh. So if we were doing this over pre-wrap, we would want half of the width of the tape on the skin. I'm trying to be nice to my subject here and not do that. So again, we'll do 3 anchors up here. Okay. Now we're going to apply our fan, only we're going to do it over the medial side of the knee. So I'm going to start towards the front, come across that medial side towards the back, and create the X. And then we just keep working our way a little bit forward and back. Ooh. So the more tape that you apply, the more support you're going to get. So it just depends how much support you want, how many fan strips you're going to do. We usually do a minimum of 3 in each direction. And then we also want to cover up as much of the surface area on the inside of the knee as we can. Okay, so there's our fan strips. Now we're going to go ahead and do our lock strips. Again, making sure that they're contracting that calf. And then we're going to do our lock strips on the thigh, contract the thigh. Once again, we could cover this with elastic tape, or we could cover it with an ace bandage, depending on what the person was doing. Most often, I'm going to cover this with shear light, especially right up close to the knee joint, or we could come closer to the knee joint with our non-elastic tape. You also can do this with elastic tape, so sometimes we'll do this just with shear light, or if we needed to create a little bit more rigidity, we could use Leuco tape or a little bit more rigid tape, which was the same thing we could do on the elbow.